left, and then we'll discuss the questions which you have formulated. So you have to answer, can you change the wordings of the questions during the interview? Like if you have formed any interview guide and while you are taking the interview, so can you change the wordings of the questions? What is your answer? Yes, Sushri is writing yes.
Yes.
Yes, yes,
Yes, ma'am.
Satyam. True. You can change. That is not allowed in case of a quantitative, because in quantitative we say you have to read the way it has been written. But in case of a qualitative, definitely that flexibility is there. Again, this question, can you change the order of the questions? Like you have formed 1, 2, 3, 4, 5. So can you change the order? Like, can you ask question number 5 before 1? Okay, true, yes. Because many a times what happens, and you should, we will discuss this issue also, but you should remember the interview guide roughly. You should, you can have one printout with yourself just to see in case you have missed out something. But you should remember that interview guide well before. You cannot keep on looking at the page and then asking the participant. There are some basic rules of the interview, like we say that you should be facing the participant. You should look into the eyes of the participant. The distance between you and the participant should not be too large or too near. So those things of communication, that verbal and non-verbal, that should be kept in mind whenever you are taking the interview. So that's why interview guide, it should be, you should memorize it roughly, and then you can have a copy also, and you can, and it's seen, like we have also experienced, like the when you do the pilot testing. So that interview, you conduct your interview with 3, 4, 5 people, maybe in your setting with your friends, with your juniors. So when you are repeating the questions 4 to 5 times, it will automatically be memorized. And then you can ask the questions without even having the interview guide to the other participants. That's why we always say that do the pilot testing. That will help you in changing the order of the question. That will help you in maybe formulating a new question then and there. Then again, this question, can you ask any extra question which is not there in the interview guide during the interview? Can you do that? Is that flexibility exist? Yes. So that is also true. You may ask, so that's why we call it as a semi-structured. It is not a structured one, and it is not unstructured also. And that's why you can ask depending on the response which you receive. You can ask any question because you don't know the type of responses which you are getting to receive. So that's why you may change, you may add questions also. So that's why it is called a semi-structured that we have discussed. Now, in unstructured questionnaire, the researcher, they start the interview only with the research question, and then they keep on framing the question. But ultimately, none of us do unstructured. We have a semi-structured guide. So now if I ask this question, like, do you think that AIMS Delhi is a good hospital? Do you? So can we ask questions in an interview like this? What is your opinion? No. So such type of questions are known as the double-barreled question. Double-barreled means you are asking more than one question in one time. So don't ask two questions at one time. Always ask one question, and that comes from practice, because interview taking is also an art. And in qualitative, that art should be well, it is a science, and it is an art also. So it should be well practiced before you go to the field, or before you go actually to the participant. I'll share one of our experience when we were conducting this RSV study uh, with the that uptake and scalability in the community. So as a pilot, we have involved many residents here in the department. I think at that time, almost all the residents were like 15 or 20 residents were there. So when we have trained them, and then they have gone to the field and they took the interview. But when we were seeing the transcript, then we came to know that there were few people who were very good at interviewing the participant. And there were few who were like most of the time uh, posing a leading question, or the interviewer is speaking more, and then the response was not that great. So again, within yourself also you will see that there are one or two people who are very good at taking the interview. And ideally, you should take care that not more than two or three people should take the interview. And it should be like, if that is there, and then with experience, like I will also like to share my experience when long time back when I was doing the taking the interview, because qualitative study was very new for me. So maybe in 2017 when I started with this qualitative research, in the initial time I was seeing my transcript. So most of the time I was speaking and the participant was not speaking at all. So then I realized, because as a doctor or as a medical professional, we always believe that it's we know everything, and we are the one who understands everything. So I was most of the time asking questions which was leading in nature. I was thinking that I am helping the people, but it was the other way around, because they got maybe they did not get a chance to speak. So that's why keep the questions very broad and wait and have patience for their turn. And then with time, if you have that patience and if you encourage the participant to speak, then definitely they speak. So it's an technique which we also learned over a period of time by going, practicing, talking to people, and then you will start. So you have to behave as if you are a lay person, very lay person. You don't know anything about the study. So that's why you try to get clarification of each and every term and each and every concept which they are saying. That means, like, you will see in tomorrow's breakout room, like, if you ask any question and if I answer, so don't assume. Remember that question of HIV is spread by touch and sex. So don't think that the meaning of touch which you think, the same meaning is a participant is understanding. Because of the context, you don't know, because of the multiple reality. We know that the reality is different, perspective is different. So you have to keep your perspective aside, and you have to think, or you have to encourage the participant perspective. So that's why that those things should be learned. Then the participant asked for an interview guide after giving consent. What will you do? Will you share your interview guide with the participant? What is the answer? Yes. So you should share your interview guide. Many a times what we do, like when we were conducting the interview of the state immunization officer, the district immunization officers, and the medical officer in charge. So when you call them for their time, so initially they become very apprehensive. Okay, are you going to record it? Then you have to share what are you going to ask, and they thought that it is something which in which the knowledge and prior reading is required. So they again requested me to share a question, a version of a rough interview guide. So before we could meet them, we shared an interview guide with them after taking the time and the slot. And then we went there, and then we conducted the interview. Again, I said that when you are conducting the interview, and if the person said something and then realized that he should not be quoted, then you should remove that particular section from that recording, or you should not report that. So that's why what should be done, not we do, that once you have conducted the interview, and once you have done with your transcript, you share that transcript with those people, especially they would like to see what they have responded and how you have framed that transcript. And that phenomena is called the member checking. Many article you must have seen that they did the member checking. So basically member checking is the member checking what they have said, and then after they agree to that, okay, they have said so such thing, then you can use that particular transcript for analysis. So that's there. Now I'll show you that Excel sheet. Okay, so Dr. Shamshad is still working on that Excel. Should we wait? Okay, word file. Okay, I think in the meantime, if he's preparing that word file of all the participants of that questions, any question from your end or any clarification which you need to seek from any participant or any question? Okay, if not, then I'll. Okay, merged. Interview guide merged. So one of you can read this. IDI, this is the IDIF of patients. So Dr. Sundar is asking, do all the people taken for the quantitative study must be included in the qualitative part in case of mixed method? No, that is not possible because in quantitative, the sample size is too large. That's why we call the qualitative study as a purposive sampling. So you may take, depending on the saturation received, we generally say that in case of IDI, 16 to 20, you get the saturation. But again, the more heterogeneous your population is, it takes more number of clients to become saturated. And in case of a homogeneity of the population, then your saturation is reached earlier. So you can never take everyone. So it's just 16 to 20, or maybe in this case, if there are many stakeholders, then you may take like 10 to 16 from each. Like in case of the RSV study, we could take the DIOs of those 5 districts and the SIOs, that is a state immunization officer, and the respective medical officer in charge. So those numbers are fixed. So that's why we took them. And then in case of patients and the ASHA and ANM, we took like 16 to 20 in each strata. So that you can do. So in each strata, that sample size is for strata. You cannot do like you have got 4 stakeholders, 4 type of stakeholders in your analysis, in your research, and you take 3 from each. No, that should not be done because each strata is like a response of the saturation of response should be in each strata. Am I making myself clear, Dr. Sundar? Is it clear? Okay, thank you. So can anyone read these interview topic, this in-depth interview guide? Dr. Sundar, can you do it? I think you are, I can see your name in the chat box. So can you read this?
Yes, ma'am. Am I audible?
Yeah, you are.
In-depth interview topic guide. Good morning or good afternoon, good evening, sir/madam. My name is. I want you to participate in the study entitled Doctor Shopping or Healthcare Provider Switch, Switching of Doctors by Patients and Families, Extent and its Effect on Health, Outcomes and Quality of Healthcare in Madhya Pradesh. For the purpose of analysis, the conversation will be recorded. We shall take care to remove the names and other identifiers during analysis. As you know, a person can fall sick due to a number of reasons. Disease state causes a person to seek healthcare by visiting professionals in order to regain health. During the course of treatment, certain proportion of diseased individuals switches from one healthcare provider to another. Today, we shall discuss such behavior. Part A, healthcare seeking behavior, decision making phase. In this step, we will discuss with you such things as how you try to keep your health good in a normal routine, and when you fall ill, how you take decisions, how you find solutions like home remedies, doctor or hospital selection, etc. Please tell us about you and your family. Probes, family profile, description of family, members, migration, profession. What do your family members do when they get sick? Probes, see doctor, home remedies, neglect or ignore symptoms, judgment, etc. Please tell us about the present health status of your family members. Probes, current or acute illness, chronic illness, hospital admissions, emergency visit. What do the members of your family do to check their health or keep themselves healthy? Probes, health checkups, diet, regular exercise, etc. How do you choose a doctor or health facility? Probes, default options, parents registered at some facility, familiarity, monetary factors, family doctors, recommended by friend or neighbor, nearest surgery to home, attracted by some aspect of services provided, attractive promises, Google review. What are the factors which make you revisit the same health facility or hospital premise? Locality wise, farther, closer, convenience in reaching these doesn't matter. Premises, basic facilities like electricity, drinking water, washroom facility, presence of test facility, diagnostic, ease in getting appointment, popularity of the doctor, flexible hours, waiting room facility, affordability, staff attitude, parking facilities. First visit fruitful, satisfied with doctors, of discuss with you how was your experience during the last time you went to the doctor for consultation. During your last visit to the doctor, how did your doctor initiate the session? Probes, smile, greet, etc. During your last visit to the doctor, what was the depth of the relationship between you and the doctor? Probes, was there anything that you didn't tell the doctor? Were you able to share anything personal? I have told everything. During your last visit to the doctor, how was your conversation with the doctor? Probes, why did you go? What were you thinking about? Behavior, explanation of illness, listening well, not being in a hurry, according to expectations, giving referrals, explanation tests, explaining about medicine.
So you can see here, thank you for
Thank you,
reading.
ma'am.
Thank you so much. You were very clear. Then can you see that it was a very nicely made questions. We are not going into the detail, but you can see the basic principle. So they've started with the initial introduction, the opening part, and then it was a middle part, and then there's a headline also before all those sub questions. And in all the questions, you can see that it has started with either how or what. I think there is no question whether where this except apart from one or two. So all the questions are open-ended questions. So that's the way we will compile this just for demonstration. We have showed this, and we'll make a short interview guide. And on the basis of that, you have to conduct the interview tomorrow. So tomorrow in the breakout room, you will we will try to make a breakout room of 2 people in each breakout room. So each one of you have to conduct the interview. So one will be the interviewer and the second will be the interviewee, and then the role will be reversed. So you will, that Zoom recording will be available. We will share it with you people, and then you have to make transcript also. So okay, so we'll give you the right to record. Okay, yeah, that's better. So you can record that conversation at your end, and then you will make the transcript. So that task will be there as a tomorrow day end of day assignment. And then when you come for the second phase of this workshop, then we'll tell about those things like coding on your transcript, which you have made. So this is how we have planned this further. And then Satyam is asking one question like in phenomenology. So I think I didn't tell you regarding the concept of bracketing. I think I forgot that. So there is something known as the bracketing in the qualitative research. That is a very important part which you should remember whenever you are taking the interview. So like I said that in qualitative research, the researcher should also explain his or her viewpoint on that particular central phenomena or on the purpose statement. But whenever you are taking the interview, whenever you are asking the interview, try not to keep your bias or your viewpoint whenever you are asking the question. So that is known as the bracketing. So in phenomenology also, when you are interviewing people, you don't, like, you keep your biases aside. You try to keep. It is not very easy to keep your biases aside, but you become very watchful of your thought. You should be watchful of your thoughts, whatever is coming, whenever you are uh, seeking any explanation or answer. And then you ask the questions, keeping your view aside. So you should be very neutral. Even if some person is like bullying, for example, if the person has been bullied uh, himself, the researcher, and if he is interviewing any person, and if he's saying that, bully is good, yeah, even ragging, because you will talk to many people and they will say that ragging is justified, it should be done because it helps the person in introduction and in so many other things, and they learn how to behave with seniors and etc. So you might encounter a participant who is telling everything against your belief. So in that context, you should always keep your view aside, because you are a victim of, you were, not are, you were, like, you have suffered from bullying or maybe ragging, and now you are exploring. So then you should try to keep your viewpoint aside or your biases aside, and then you should try to interrogate in a very neutral manner, like why he thinks so, or what is his perspective. In that case, if you with your gesture or with your non-verbal this thing, if you show that you are not liking whatever he is saying, because even if you are thinking and if you are not conscious of your non-verbal gesture, it might come into your non-verbal gesture, and that participant is smart enough to see that you are not liking the response. So in that context, you have to be very aware of your thoughts, and you should try to keep your thoughts away from your biases or whatever your exposure, initial exposure on that event. That's not very easy, but that should be tried. That's why we express also that what is our belief, or are we a sufferer of that particular phenomena, or as a author, do I believe or I don't believe, or what is my viewpoint. So that's how in phenomenology also we have to bracket our thoughts why we are interviewing people. That bracketing is only when you are interviewing, and then again when you are preparing the result also, because in result also you should not code only those things which are favorable to your axiology. You have to report also that one person who is not fitting to your idea. Okay, so did you get your answer, Satyam?
Yes, ma'am. But by looking at the tropes, I got this question because my study is also phenomenological study. But if I
Okay.
put probes in my interview guide, so isn't it that I'm guiding the person in my way, whatever I
No, no,
want
no,
to
no,
find?
no. No, while you are interrogating or you are putting, because unless and until you put the probe, you will not be able to get the insight. And that probe, obviously, it should not be a biased probe. It should be only on the basis of the answer which the person has given. So, like, probe means if you are not getting something and you want a clarification on that, you can further probe. Like what? Like, I'll just give you an example. When I was interviewing one of the person who was suffering from HIV, so he said that he did not disclose his status even to his wife, to none of the person who were in the surrounding. So when I asked, like, what was the reason of your this behavior, then he said that why he did so, because he has seen somewhere that by killing the people, there was a cow who was suffering from HIV, and when the people they came to know, then they killed that cow. So he thought that if he will tell that, he will also be killed. Then in that case, you could further probe that by killing means that what was that fear of that killing. So was that fear, how was that fear developed? So then he again told the entire story. So that probing is from the response which you get. In that context, that no bias of mine was there in that probing. So that you can, probing is always required. Otherwise, the deep insight or, the entire perspective, you may not be able to know. So that is needed definitely in phenomenology also, because in phenomenology also the lived experience, you have to help the person in remembering, in recalling the event. It may not be possible because that event may be 6 months back, or maybe even if it is recent. So like your studies, phenomenology of which, what is the central phenomena in your study?
Ma'am, difficulties faced by caregivers during pre-procedural fasting in children.
Okay, so
Pre-procedural fasting. I'm assessing the experience of caregivers who faced a lot of difficulties during pre-procedural fasting.
yes, so while they are answering like pre-procedural, see, my child has been like fasting for maybe 24 hours or 8 hours or 10 hours. He's asking for food. What should I do? So in that context, you can ask like, then how do you? So once you do the pilot testing, you will come to know, like you do the interview of 3, 4, 5 caregiver just before you start the actual interview. And then you will come to know what this probing is. This will not definitely be against the principle of phenomenology. So
Okay,
probing
ma'am.
is to further understand their perspective.
Yeah,
Okay.
thank you so much, ma'am. Yes, ma'am.
Okay. So now if I see this interview guide, so this is, so he read till this point, and now there are other questions also. So like I can ask somebody else also to, just a second. There is a question of another team also, that this is of room 2. So because the room, they have done a very exhaustive job of writing these questions and in a very short time. So in the room number 2, like who will read this? One person from room 2 can do. Anyone from room 2 here?
Yes, hello.
Yeah, Bakar, sorry. Can you read this?
Uh, uh, Question 1, tell me about yourself. Question 2, in your previous illness, did you visit multiple doctors?
Okay,
Question
so
3,
is it
okay.
a close-ended or an open-ended question?
Ma'am, 3 can be in continuation of 2.
Okay,
According to you, what were the reasons that made you change the doctor?
okay.
4, what do you understand by doctor's shopping?
Mhm.
5, imagine if you were a doctor, then how would you behave with your patient?
Okay, so this
6,
is a which type of question? Fifth number question.
hypothetical.
Yes, very good.
Uh, Sixth, how does doctor shopping affect your health?
Mhm.
And seventh, according to you, what were the detrimental and beneficial effects of doctor's shopping?
Mhm.
Eighth, it is again hypothetical. If you were a healthcare administrator, how would you improve the quality of healthcare?
Okay, good, very good. Thank you. So, all of you have done a wonderful job. Like in a short span of time, you have framed good questions. So, room number 3. Anyone from room number 3 can read this. Any representative of room number 3? Maybe the team leader can also read. No one?
Yes, ma'am, I was there in room 3.
Okay, Satyam.
I thought um, we'll develop an IDI guide for patients to know their perspective on doctor shopping and its effect on their health. Opening section, introduction about ourselves. Then tell me about yourself. The probe will be age, accompanying person, place of stay, distance from the health facility. How are you feeling today? What brought you to the hospital? Mention about the purpose of IDI. We will be mentioning our purpose and then consent. And then in middle section, we'll ask how many times have you visited the doctor in last 1 year? What was the reason for the visit mostly? What was the most recent visit to the doctor about? What was your condition when you visited the other doctors or hospital? How did the doctor respond to your problem? Where else have you been before the present condition? Probe will be pathway of care, any particular doctor, hospital, or traditional healers. Can you tell me about the doctor or and what made you choose to change the doctors and go to the another doctor? And probes for changing doctors are unnecessary investigation, cost, long waiting hours, duration of treatment, symptoms, relief after first visit, any side effects, type of facility, recognition of other doctor. Then how was the experience with the next doctor you visited? What according to you would have been better for, मतलब क्या हो सकता था, हमने इसलिए फ्रेम किया था कि आपको क्या लगता है क्या बेस्ट हो सकता था. Then closing section will be what else do you want to add apart from these above mentioned points, and thank you for it.
Okay, so that's nicely framed, like they have included that initial opening section, middle section, and closing section, and relevant portion they have included in the respective portion. So thank you so much. So room number 6, yes, they have written the names also, team members, Dr. Sushri and Dr. Preeti. I will ask one of you to please read.
Ma'am, I am the team members, like myself, Dr. Sushri. So
Yes.
the first question, like ma'am, the first question we would like to ask, like, could you tell us regarding yourself, like the name, the prompts will be like the name, designations regarding the work experiences and the experiences with the patient. The second would be like, what do you think about the provider switch, provider switch definition, like what they understand that, ma'am. Other questions also we have written it, ma'am.
Somebody,
Hello.
I'm coming.
Can you hear me, ma'am?
Yes, yes, I can hear you.
Ma'am, this is IDI for doctors. फर्स्ट क्वेश्चन है, सर नमस्ते, कृपया पहले आप स्वयं के बारे में बताइए.
Okay, okay, okay. Let me. I think that was the end. After that, we could not, Preeti, your and Sushri, your questions, I think we could not complete it. Maybe we could not paste
Ma'am,
it.
we have added other questions also to that, like we
Yeah,
we are
no,
having.
no. But I think that got missed while we were making this document. So never mind. We'll again
Yes, ma'am.
see those comments and we'll compile it. Thank you so much.
Yes, ma'am. Thank you, ma'am.
Yes, can you say the other person, your name is not visible. Actually, it is saying Acer.
Ma'am, I am Manmohan Sahu.
Okay, Dr. Manmohan. Yeah, please.
मैम, फर्स्ट क्वेश्चन है, सर नमस्ते, कृपया पहले आप स्वयं के बारे में बताइए. माय सेकंड क्वेश्चन इज, वो कौन सी बात या वाक्य जिससे आपको एक डॉक्टर बनने की प्रेरणा मिली. और थर्ड वन इज, जब आप प्रथम बार किसी रोगी से मिलते हैं तो आपका क्या स्वभाव रहता है. फोर्थ वन इज, मरीज आपकी किस बात से अधिक प्रभावित होते हैं. सॉरी, वो गलती से मैंने प्रेरित लिख दिया, किस बात से प्रभावित होते हैं.
ठीक है, ये स्वभाव में भी हो सकता है कि आप कुछ और प्रॉम्प्ट अगर डालें कि स्वभाव से क्या समझते हैं, क्योंकि हो सकता है
क्या व्यवहार रहता है, ऐसा हम लिख
व्यवहार
सकते हैं.
मुझे लगता है. ओके,
हाँ, क्या व्यवहार रहता है. फिफ्थ वन इज, आपने क्या महसूस किया कि मरीज लगभग कितने दिनों के बाद आपके पास से स्विच कर जाते हैं. सिक्स्थ वन इज, ऐसा क्या अंदाजा लगाया कि मरीज लगभग कितने दिनों में आपको बदल रहे हैं.
ओके.
सेवंथ इज, ऐसा खास क्या कारण है कि मरीजों को कौन सा ऐसा डॉक्टर का व्यवहार है जिससे वो चिकित्सक बदल लेते हैं. क्या आप स्वयं मरीज को किसी दूसरे चिकित्सक के पास भेजते हैं या रेफर करते हैं.
ओके, तो जैसे कुछ इसमें आपके क्लोज एंडेड भी है, ये क्वेश्चन लास्ट वाला, और
जी.
बीच में भी है, बट अदरवाइज
हाँ,
आप
मैम.
ओपन एंडेड है. ठीक है, आप पहली बार के हिसाब से बहुत अच्छा है. इसको
Thank
और
you, ma'am.
एक बार टेस्ट कर सकते हैं अपने जो आपके हैं क्लाइंट. जब भी आप ऐसा करें तो जो आपने रफ बनाया है उसको एक बार पूछ के, वो और भी हमारा बेटर होता है इंटरव्यू गाइड.
जी जी, थैंक यू मैम.
Thank you.
Thank
So
you,
yes,
ma'am.
this is group 7 for doctors. Group 7, who was the team members?
Ma'am, Shraddha ma'am, Manisha ma'am and I were there in this team.
तो श्रद्धा, मनीषा कहाँ है? Where are they? Are they?
Hello, ma'am.
Yes, ma'am, I'm here. Shraddha ma'am is also there.
So Shraddha, you can do that.
Okay, ma'am. The first question is, tell me about yourself regarding your specialization, place of work, and years of experience. The next one, what is your experience with your patients? Next one is, what is your opinion about doctor shopping? Or what do you understand by the meaning of doctor shopping? Then what is the effect of doctor shopping on patients' health in your perspective? Next one, can you give us some example where you have encountered doctor shopping? And what are the reasons for doctor shopping in your opinion? And how do you think what do you think the problem of doctor shopping can be overcome?
Yes, so these are very precise and I think all important questions because you have even asked them to give some example. So then they can quote like their experience and maybe many what happened with one patient or the other. Because when you ask something like this example, then their mind also starts working and then they share a lot of experience. And again, that problem also you have asked like how it can be overcome. So that's good. Participant, the Kalyani, Dr. Parvati, Akanksha, Dr. Room number 8, Visheshwara, he was the time. So they have written it again the way we have instructed, like all the name of 4 people who were the timekeeper, who was the group leader. So that's good. Yes, are they join? I mean, right now, are they there in the main room? These 4. But I think one of you can please read this. Hello. Yeah, I can hear you, but your
Akanksha.
yes, Akanksha. Yes, now I can hear you clearly.
So observation checklist starts with first, did they greet each other, both the doctor and the patient? Then doctor asked the patient to take the seat. Then asked about patient details.
Okay.
Actually, the numbering we have shifted, so don't
That's
mind
okay.
for that.
That's
Then
okay.
yeah, then eye-to-eye contact while greeting and asking the things. Sure, doctor is showing interest in actively listening to the patient. Maybe scroll down. Then did doctor ask, is it the first visit or the follow-up visit of the patient? Then depending on that, ask the patient the presenting complaints. While listening to the complaint, is he or she is showing empathy to the condition? If it's a follow-up visit, did he ask the condition is improving or elsewhere? And meanwhile, the whole this conversation is comprehensible at both the ends, both for the patient, what patient is saying and what the doctor is saying to him regarding the language, regarding the medical terminologies and other things. And if relevant examination is needed, so is consent taken for examination? Privacy during examination, if it's a female patient, is he accompanied by the female attendant or others? Then the same thing, the relevant examination being done. Then finishing all the clinical examination and other things is the doctor is explaining the current condition and the prognosis to the patient or the attendant. He whatever advice or prescription or the investigation needed, so is he summarizing the advice given to the patient or the attendant? Then when to return for the follow-up and greet them at leaving the OPD.
Wow, very nicely made all these checklists. So good work. Thank you. So maybe the other checklist by group 9, Dr. Madhumita, Dr. Chaitra, and Dr. Sundarshwaran. Anyone from the
Good
group?
evening. Good afternoon, ma'am. This is Dr. Madhumita.
Yes, Dr. Madhumita. Can you start reading the checklist?
Yes, ma'am. How the patient is addressing the doctor when the patient enters the room.
But if you're asking the question like this, how then?
No,
how?
no, like we are observing whether the patient is addressing the doctor, he or she is greeting the doctor or not.
Okay.
Then
so
how
the
the
answer
doctor
will be
is
like yes, no.
welcoming the patient. He is getting up, he is doing a handshake, or he is greeting him, and whether he is asking the patient to sit down, making him comfortable. Then is the doctor remembering the patient's name, history, or anything which makes the patient think that the doctor remembers him and builds a rapport? Then any other rapport building questions which the doctor asks to the patient, like how are you, how is everyone in your family, and other small talks. Then is the doctor able to talk in a local language and also ensure that the patient understands what he is asking, what the doctor is asking. It should be comprehensible, not only a jargon of hi-fi terms.
Okay.
Then we come to the history taking, how he takes the history, and if the history taking is designed in such a way that it caters to each individual case. It's not like a bland pro forma which is following for every patient.
Okay.
It should be detailed and customized as per required. Then asking about the symptoms uh, which the patients have told, and also the anything which the patient might feel which they have not talked about. If the doctor is asking about this, and also if the doctor is discussing his viewpoint about the differential diagnosis, then we come to the paperwork. If he is writing down all the complaints, the detailed history, and making a proper documentation of everything. And then while the examination, if the doctor is taking proper consent before examining the patient, if he is asking for a female attendant, if he is seeing the modesty of the patient is well taken care of, then then also the doctor's mannerism, whether he is listening to the patient with patience, or he's interrupting in every little thing the patient says, the patient's expression when the doctor is giving them some advice, is it like forthcoming, they are willing to listen, or their attitude shows very upfront confronting nature, whether the doctor's way of giving advice, is it reassuring or arrogant or bossy, or it's a negative, or he's criticizing everything the patient did and should not have done, or it is in a very positive manner, like okay, you have done this, it is good, but like that he is going on. Is the doctor interpreting the advice of the bystanders properly? And like there are certain factors when the patient is coming, he is saying that my local people had said this or not. Maybe it is not right, but if he is not being very confronting with that, whether the patient, this one I have already said, and whether he is explaining the prescription and the medicines for which it was given, he is telling him about the major side effects, whether he is reassuring the patients, and also explaining about the different investigations needed, the cost factors associated with it, whether he is explaining the government subsidies which might be available, the programs which might help him to get the treatment uh, or the investigation at a low cost, and all other things that can be done to reduce the expenditure in healthcare. And then asking if there is any doubt of the patient, if they have any doubts which they want to clarify, giving a patient the chance to speak for himself. Then if he is addressing to all the questions asked by the patient, and we can also observe if the patient, if the doctor does something to ensure the compliance, if the asking for proper follow-up visits, offering a free consultation, and then also the patient's face reaction and mannerism at the end of the session, like were they satisfied.
Okay, very nicely done, very exhaustive. I think in a short span of time, how few people could do this? A lot of work and a very nicely framed.
Thank you, ma'am.
Test. Very nicely framed. Congratulations to all of you. Wonderful work. So I think with this, we can end today's session. And then we'll again meet tomorrow. Tomorrow is again, there are 2 breakout room activities. And tomorrow is where we'll learn the steps to conduct the in-depth interview and the focus group, and then how to make transcript. And then you have to do the interview also. I said that, and you have to record also the interview from your end. So is there any end of the day assignment today? So there's no end of the day assignment today. So we'll again meet tomorrow at 9:30, probably 9. So today's we started, I think 9:55, 45. So we can expect the same tomorrow. Okay. Is it okay for everyone? Yes or no? Let me see. Okay, yes. Okay. Thank you so much. Good day to all of you. See you tomorrow at 9:30. I'm saying because 15 minutes already there will be delay. So 9:30.
Thank you, ma'am. I have been listening very intently.
Okay. I thought you are in a meeting, Sanjeev.
No, I am
That's
always
why.
here. I was all around here. I
Okay.
was even in one of the breakup this
Record
one
zone.
room you
Okay,
called.
okay, okay. Chalo,
Thank you
good,
so
good.
much. It was great.
Chalo, thank you. Thank you so much.